Who's a local electrophysiology fellow. He's been trained here in Cincinnati. He's one of the rare birds that has both heart failure trained background in his medical upbringing, and now he's going into electrophysiology. So for those of you who have perhaps both heart failure and risk of sudden death, Dr. Munjal is a particular expert. So without a long intro, Dr. Jitender Munjal from the University of Cincinnati.
Thank you for that kind introduction, Mark. And, I've been here for 8-9 years, trained at Jewish and for 3 years and did heart failure fellowship, as you said. And I'm now finishing up my EP fellowship. And I'm going to stay at the university after that. So, well, I understand all of you have this box in your chest, and that's what you're worried about, right? I have this box, and how I'm going to live my life I used to do in my 20s. So we can discuss. This is very informal, so you can ask me any question you have, anything about heart failure, management, anything about your device, how they function, what you can do, what you cannot do, and how often you should call your doctor. I mean, anything is open. So I'll start with you.
What can you expect when the defibrillator goes off? Do you fall down, the slide or the brake? If you're driving your car, it can cause an accident. I don't know anything of the accident. I've only told me anything about it. They just put the defibrillator on.
Okay. So it all depends what kind of arrhythmia you have. If you have arrhythmia and it's not stable, there's chances of you passing out. And on top of it, when you get shocked and you're conscious, at the time the chances of, if you're driving, you can have an accident. But, but most of the times people are conscious when that thing goes off. And they can maneuver their car or thing on the side.
There's no warning.
There is no, typically you will feel like you have some dizziness, you'll be sweaty, you feel like something is happening. If something happened to you, it's a good mark that, okay, fine, I should pull over to the side and stop it. So just feel your body, you should know that what's going to happen, that if you feel dizzy, you feel sweaty, you feel like, oh, is everything blanking out in front of me? Stop, take a break, go to the side, there's nothing wrong, call somebody whom you know, or call 911. What happened? I'm not feeling well, I have this box in my chest, I'm afraid it's going to shock. So, but we want to go out of this and think about normal living, right? We don't want to worry. See, don't worry and be happy, right? So we want to leave the worry out. Yes, you will get shocked. The life that you look at the statistics, the chance of getting shocked in 10 years is maybe 1 or 2 times. I'm not worried about that. That's the chances that I will get an accident today, going back home, right? So I won't worry about that, right? Okay. So let's go further, and that's what we want to talk about, that whether you have ICD or not, you should be happy in your life. And try to do not stress too much, and I'm glad you brought this up. So that's my first worry. When I first got my license, I thought, they drive so fast in the US. I used to drive like 40 kilometers per hour, and it's like 100 kilometers per hour if you go by miles, and it's 60 miles per hour. I was scared. No, not anymore. Actually, it was scared. Anyways. Oh, thank you, man.
Moving back up.
Probably not related to the power. So anyway, that's what we want to do, that we want to make sure that you leave this worry to us. And this device, as of you have different reasons why you put this device in. You have a cardiomyopathy or heart failure, that could be the reason, or you have a bad arrhythmia with no disease in your heart per se. That could be the reason why you got this device. There are other main reasons why you get the device. So depending on your underlying disease, this device may not be actually shock to health. So that's the important part to know. And you put these devices in people who have low heart function, like people who have heart failure, low injection pressure. Your doctor must have talked to you about, like, oh, your EF is like 33%, 96%. 36% you don't qualify, 33% you do qualify. Those are numbers. But you need to know that time that your heart function is low. And your doctor is worried because the heart function is low, chances of having a sudden cardiac arrest are high. That doesn't mean that you will have it. That doesn't mean anybody will have it. But your chances are high. And this device is your insurance policy, so that it will protect you if that happens. I mean, everybody has insurance policy. You can't drive a car, you have insurance policy. So that's the main thing.
You did a stupendous job filming that until that happened.
Well done with your computer skills, though. Okay, let's go forward. So, only time you should think about this device if you're taking a shower, maybe. And not any of those times when you're exercising here. If your wife tells you to clean your house, little device, don't sit down. No, don't do that. I might use that. If you need a microwave and you're driving, don't think about it, like, or you visit your close ones and you should not think about it. All the time you think, okay, fine, you're taking a shower, it's the same thing, okay, fine, stay. But don't rub it, okay? If you rub it, you might open up the So, and at the airport, you all should have a card which you should carry, and they should know that everybody knows that what a defibrillator is, and you can tell them that this is what I have, and they should not use anything. I don't know if they change anything within magnetic field or anything. They should not be using that, but everything they use in the airport these days is fine. And like we talked about, why we need ICD and how does it work? So the way it works, it looks at this funny-looking tracing there. If you look on the top left side, and this is a bad sign. If I see this tracing in my lab, I get scared. I get anxious. I need to get the patient out of this. This means death. That tracing means death, and that tracing below means life. So if you see the tracing above, you're worried about it, and you get anxious. So this is what your device is looking at. This device is looking at, okay, fine. If this happens, I'm going to give you a shock. I'm going to get you out of it. But this is not the only thing which device does. There are certain heart rhythms which go fast that will make you pass out, and if they're fast enough that you may go into this rhythm, the device may shock you. Now the therapies are so advanced that all those people who are looking at devices, they have therapies which can pace your heart faster. And at the time you might feel like, oh, suddenly my heart is jumping fast. At the time you're getting something called pacing, and that helps your heart to get out of that rhythm. So you may not get into that part. So, and if the device sees something like this going on, it will give you a shock. And this is the risk, like I talked about the heart failure, ejection fraction, and if you have previous heart attack and your heart function is low, then also you get to the device and you are prone to these rhythms. If you look at, if you didn't have this ICD, and you thought that, you were better off, there's nothing happening, like you said, you never got shocked. So why I had this thought, something foreign in my body for no reason. But if somebody gets into that rhythm that I showed you, the chances of, every minute you lose in that rhythm, it affects your brain. And if you stay more than 3 minutes, chances of your brain death, dying brain, irreversible function is very high. At that threshold, more the time elapses, chances of irrecoverable damage is very, very high. So you don't want that rhythm to be, you don't want to be in that rhythm. And your device, when it sees that rhythm, within like 3 to 9 seconds, it shocks you, depending on what you have. So that's a very good thing. And I'll say, it should be a question form that, but where should you have a cardiac arrest that you have to have? You can go to horseshoe pacing, I don't know about that one. But lastly, this is the place. And some people get confused by, people say that what's heart attack and what's the sudden cardiac arrest. They sound the same, my dad had heart attack and he still asks me about what's the sudden cardiac death. Doesn't understand. Still don't understand. Because you don't see that rhythm. You don't, unless you see the paper which shows those BB lines which are going very fast. That's the cardiac arrest. The one which you have some pain, your artery plus blocked, your heart gets damaged, that's the heart attack. That's the common, most of the people use that kind of common language. If somebody asks you, doctor asks you if you had a heart attack, he's asking about your vessels, if they get blocked. If they're asking about you had cardiac arrest, that means your heart stopped. The heart stops when you have a funny looking EKG. So that's the difference. And some of the folks I understand that have heart failure. And see, we talked about the electrical component of the heart, the electrical activity that you see of the EKG. The other function, main thing we know is a pump, right? It's pumping. It's pumping every second, every 60 times a minute it's pumping, getting the blood out. Believe it or not, it takes 6 liters out in a minute when it's pumping. And if it doesn't pump, your all functions right from your eyelid movement and the toenail movement, it needs blood supply. So if your heart function go down, your all function go down in the body. So those people, that's what we call heart failure. So that's the difference between heart failure, heart attack, and sudden cardiac death. So these three differences, as you know, this device you have, you should understand that. So if you have low heart function, you should be getting best management for your heart failure. You should be on a good medication for heart failure, so that you have maximum therapy there, and then you have this device so that you get the maximum benefit. And so as I talked about the ICD, it can detect and do cardio work. And I don't know if some of you have atrial arrhythmias, that means atrial fibrillation. So if that's the top chamber of the heart, and it's beating in a bad fashion. In the same fashion as the bottom chamber, beats, it gives you shock. If the top chamber beats, it's called atrial fibrillation. I don't know the statistics, but 30% people over age 70 have that. And some people have few days, some people have every day. So if you sometimes go to your doctor and you have this device, what they can do is, instead of using the pad, the shocks, they can shock you from the device. So that's really a discipline. And as I talked about, this is called the tachycardia pacing, which I was talking about. It tries to pace you out. It tries to outrun your arrhythmia. Because arrhythmia is running fast, it's trying to outrun that and start to stop it. It's like you're having a car race, one car is going and then goes faster, comes and blocks in front of it. So that's what the pacing does. So it tries to pace you fast, stop your arrhythmia, get you out of it, so you don't get the shock. So that's what the ATP does. And you probably won't, only time you will know when your heart suddenly becomes fast. Like that would be a sign that, okay, fine, suddenly the heart going fast. Why? Pull over before something happens. And that device also is kind of a mini computer. It saves a lot of data in there. It saves your activity. It saves how much you're moving around. You cannot come to my office and say that, okay, I've been working on 3 hours a day, and your device says less than an hour a week. It doesn't make any sense. I'm not saying you lie, but people have tendencies to lie. I lie. There's nothing wrong with that. But talk to your doctor. Try not to do that, because we know what you're doing in your heart by the rhythm marks. So it does everything. It does your activity, how much arrhythmia you have, how many extra beats you've been having. If you're having a lot of extra beats, the doctor might decide, okay, fine, he's having a lot of beats and that's causing low function. You may go out after that. So those are the two things you can get with this. And now the technology is so advanced that if your heart function is low and you meet certain criteria, they can put an extra lead in your heart to get you a pace in a proper way, so that you get the maximum amount of blood out of the heart. The main function of the heart is to get pump the blood out of your heart to the body, so that you can move all the parts of the body. So that's the main objective. And putting this extra lead can help. And additionally, all those things which you can do with this device. And additionally, it lets you have this device in not all of, I think almost all companies have this what you call home monitoring. That doesn't mean that you don't have to go to the hospital to see a doctor, but you can transmit your, if you're not feeling good, you call your office, tell them, okay, this is going on, I'm going to test the data, your doctor take a look at it, and see what's going on. So this is very helpful. It's, your doctor can be sitting in a cafeteria or anything. He gets this text messages. Now the technology is so advanced that you can look at a touchpad and see, okay, what's going on. You just open the strip, okay, this patient needs to be hospitalized. It's so fast right now. Compared to, you wait for the office visit, they interrogate the device and see what's going on. So if you don't feel good, some devices need you to be near the phone line to transmit. Some actually use the cell phone. So there are different devices which transmit the data in a different way. But I think technology is advancing, and everybody's going to use a cell phone to transmit. But anyway, so there are no limitations as you see with the device. I don't like that. I don't think I can do that. But make sure that you're there when you feel yourself that okay, something's happening. You're sweating, you're feeling palpitations, you're going to pass out. The moment you get that, even if you haven't had that, there's nothing wrong in pulling over. Because the amount of damage you can cause on the highway is enormous. So that's what I would recommend, but you should not be worried about it. Chances of getting shocked are very low. The people who get shocked, at the time, either something is going on with them, they have fever, they have diarrhea, they have bad electrolytes. Most of the times that's the reason. Or they have a heart attack. Most of the time that's the reason. So not everybody does that every day. So I don't think you will be worried about that every day. Okay, like that, okay, this was a good shot. And I don't think I will ever do those activities where I try not to do sport diving, not to do whatever. I asked somebody to change my filters in my furnace, and I probably won't do that. So, and these things, earlier there was a misconception that those things can cause trouble when you're around, like a microwave. So, first question everybody asks me is, oh, there's a microwave. Well, unless you sit inside the microwave, that's a different story. But otherwise, it's not going to affect it. Anyway, and cell phones, there is no data to support that it affects your device. One thing you should be worried about when you go out, if you see that cable which says 10,000 volt passing through transmission lines, so I won't go close to that. And, that can actually have a good amount of magnetic field, and that can cause problem with the device. It usually doesn't cause a whole lot of magnetic field, so it doesn't cause really damage to the heart, but it can change the settings. Only thing that you can be worried about. But if that happens, just go and see your doctor, and they should take care of it. And as I said, some people think, patients will come to me and they have heart failure. They think, okay, fine, you got into this procedure, you got into the vein, in the heart, and you got these 2 leads. That's going to protect me from ever. No, it's just insurance policy. Your insurance policy doesn't do anything for you, right? It sucks your money out, actually, unless you use it. But these are the medications. It's a whole-term policy rather than a short-term policy that you invest in that. You take medication regularly. You go to your doctor. You tell me your symptoms, and take medication as needed. That should keep you out of that bad rhythm which I showed you before. So our goal is to not have a shock. And when I'm sitting in the doctor's office, I want to make sure that you don't get shocked. That's the primary goal we have. So that's why we need medication adjustments. We make sure that you take the medications, you take all precautions. If you get sick, you seek attention. But you know that the chances are that if your blood is messed up some way, you're going to get shocked. So you need to be aware of the fact that you should see a doctor if anything goes wrong. Like I talked about this thing, magnetic fields which can happen with welding, and there are a few devices they're coming out, and they are MRI compatible, especially the pacemaker. ICDs are also compatible. Typically, most devices you can still do MRI, but the radiologists, they don't really like to do that. We can help them sometimes. If the real case you absolutely need the MRI, the electrophysiologist near whom you're seeing, they can help you with that. Some people have lower, comfort zone of doing anything like that because potentially the magnetic field can damage your heart, but it's doable. But again, you have to have a really good indication to do that procedure. Again, so as I said, don't let this box interfere in your life. Just continue your life. Don't worry. Be happy, and try to enjoy your life, and follow healthy diet, eat healthy food, control your salt intake if you have heart failure, the problem with fluid balance, and make sure that you have a plan in case, like he asked me, that if you get shocked, what should I do? If I'm sitting at 2 in the morning, what should I do? I've got shocked one time. Try to call your friends, tell them you should be near, you're sitting there, call your closest friend, okay, sit with me, I'm not feeling well, just sit with me, call for help. If you got shocked again or you lose consciousness, call the 911, there's no harm, just get out of there. Because your friend probably wouldn't be able to know that what's going on, so you need to get to the hospital. If somebody, like I'm sitting with him, I'm touching him, and my defibrillator goes off, it's not going to affect you. So that shock doesn't travel to the person. Unless you put your finger inside the box, it's not going to happen. So, which you're not going to do. So that box is not going to affect you. So if you know somebody, you have a defibrillator and you have a defibrillator, you got shocked, help him. You know that it's not going to affect you. So to make sure that you have a plan. So you have exit plan. Okay, fine. I know that in Cincinnati, highways don't have much of the shoulder most of the times. But try to get out the shoulder and exit from there. And this is a wonderful website which I went last night, and you can go there and look for more advices and see if I missed something. You can go there. All right. Any questions? Yes.
Can you go back a little so I can get that website for?
Oh, sure, absolutely. I'm sorry.
Thank you.
Probably the line to go. And that was a good day.
Was that Mark?
Yeah, we're going on.
Yeah.
So any questions for me?
They say normally the lifespan is probably about 10 years of the ICD.
Well, there are two things to look at it.
6 to 10 years.
What you're talking about is the battery, the box itself. So once you get this procedure, you get the leads, and 99% times the leads are fine. So depending on how much therapy you're using, if you use a lot of battery, it's like your cell phone. If you use like all the time, it's like half a day is used. If your heart doesn't do that much, after 10 years.
9 years for me.
Well, that's not very nice.
I've been working, I have a shop here.
That's very nice. That's right.
There's big, I might need to change the seal.
Yeah.
I'm checking the back of the
Battery's
voltage
gone.
level is dropping.
Right. So that's very important. That's why you need a regular follow-up and you go to the doctor so that once you get this knee battery change, the next 10 years you probably will be doing the same.
So every month I have to do the care.
That's very good. That's very good. One of the very compliant patients. Yes.
About more than a month ago, maybe a month and a half, on Channel 9, Healthy Something, was talking about Florida Hospital has a new device for people with heart failure. And they said there is I think it was called a parachute. And then it does something and it's going to stop a lot of problems. It can increase your heart failure so much better.
It's,
Have you
I
heard
think she's
about
talking about
Yeah, yeah.
left atrial appendage devices, yeah.
So
I'm sorry, what was that?
I can explain it to you. So your heart has 2 chambers on the top and 2 chambers on the bottom. When your heart is disorganized, the upper chamber is beating in a bad fashion, it's not organized. What happens? Your blood collects in that chamber. And there's something called appendage. It's like a pouching in the heart, where the thrombus forms. So what they're talking about is that if they close that pouch, you won't have a thrombus and you won't have a stroke. It doesn't improve the heart function.
Okay.
So if you heard something else, there's something called, if the patient has heart failure, there's something called left ventricular assist device, where they can put in the heart, it functions the artificial heart and pushes the blood out of the heart. That's a different thing. They do that too.
And you haven't heard about anything called a parachute.
That's the parachute that you're talking
That
about.
is the one
The first one, the thumb which goes
for
into your appendage
AFib.
for the AFib.
Okay, I thought I listened to for heart failure, which means the left ventricle, you can use some kind of device there.
Right, that's called heart mate or LVAD. That helps you to move the blood. That's a little different device, and we don't put those. But the surgeons put those devices.
Okay. So do you know if they're doing that now with people who have AFib?
It's not approved by FDA yet. That I can tell. And that university we don't do that.
Most commonly, B-FIB causes SCA, right?
What's the
Most commonly, B-FIB causes SCA.
Yes, that's the certain cardiac death. That's the same thing.
AFib also could happen, right?
No, AFib doesn't cause you certain cardiac death. It can rarely cause, but in a certain structure disease you have to happen that, but it doesn't cause you to have a ventricular fibrillation. That's a very good question. Any more questions?
Frankie, can I ask Frankie, do we have the shock plan?
Yes, I have some magnets. I'm going to do announcements later too.
Sorry.
I just want to get, he's got kids to get to the pool, so.
That'll be fine. They make me exercise. Last time I went to our home and it was, let us go to the gym. It's killing me.
Yeah.
6:30 in the morning, I want to take the gym, and no way. I have to go. And I sat on the side with
And watched.